Hi, everyone. Welcome to Bad Therapy. I'm your host, Sam Diego, and I called this podcast Bad Therapy because I am a therapist. I'm a nationally certified therapist. I have a master's degree in mental health counseling as well as a concentration in crisis and trauma. I'm wondering if there's any other credentials I need to tell you. Just wanted to give a little introduction to myself and to the podcast because this is our first episode. This is going to be the codependency episode. But before we kick off with all the mental health stuff, I just wanted to, kind of introduce why I wanted to start this podcast, a little bit about myself, and then we'll jump into the content. So I'm originally from San Diego, California. Moved out to Ohio for college, went to Franciscan University of Steubenville in Steubenville, Ohio. I still currently reside in the Ohio Valley with my 3 kiddos and our cat, Bread. Give us this day our daily bread. If you hear him running around in the background, he's got a little bell on him and he's also meowing. So my assumption is Bread will be a consistent guest co-host on the podcast. But besides just the basic facts, I feel very passionately about mental health, and I always have. I've been in and out of therapy since I was 13 years old. More recently, I have had the same therapist for the past 7 years, and God bless her because I've been through it. But I also, in that time, became a counselor for others. A lot of people get into this work for exactly that reason. They have overcome a lot in their own personal life. They have skills that make them a happier, healthier person, and they want to share that with other people who are struggling. And that certainly was the case for me. It started with advocacy work. So I helped run a peer support group for moms with postpartum. I attended one ran by this phenomenal therapist. It was called Out of the Blue, and it was just great. And because I lived far away, I asked her permission, and of course the permission of the group members, if we could have an online presence. And I kind of was the admin for our online group, which was great. And then, several years later, I was pregnant with my 3rd child, but I was still looking for work. We're about to have 3 kids. And a friend of mine said, hey, we're currently hiring a new sexual assault advocate, and I think you'd be a good fit. So I did that work for several months, and it was really rewarding. But in any of these roles, I thought, God, you know what? I wish I could do something more. Validation's important, camaraderie is important, but I wanted to actually help people. So I went back to grad school and decided to become a counselor. Now, I've seen a lot of different counselors, social workers, mental health professionals kind of get in on social media. And they offer like psychoeducation on like what are certain things, or if you've experienced these things, you might want to consider going to therapy or getting psych testing done, or you might actually fall under this umbrella of diagnoses. And while that's great and it spreads awareness, I can't tell you how many clients have walked into my office with like a self-diagnosis and been really wrong. Every once in a while, they're right. But the main reason I call this podcast Bad Therapy is because I want to emphasize that the show is not a diagnostic tool. If anything we say or discuss comes up in your personal life, I'd totally recommend going to do an intake with a counselor. See what they think, see what the professional thinks. So I want to spread awareness without spreading panic. amongst the mental health hypochondriacs of the world, and that's myself included. But I do want to talk about this topic that I love and that I am passionate about. So, without further ado, we're going to discuss codependency. Now, I think the format for these episodes is we're always going to start with what is it? Whatever the disorder, the topic, the theme is, always going to clarify the agenda and what we're actually talking about. So first things first, let's get into what codependency actually is in the casual sense and in the clinical sense. So Mental Health America says codependency often affects a spouse, a parent, a sibling, a friend, or coworker of a person who is afflicted with alcohol or drug dependence. Originally, codependent was a term to describe partners in chemical dependency. So persons living with or in a relationship with an addicted person. Now, they are referring to like chemical dependency, meaning like a substance, drugs, alcohol, things of that nature. But I believe some people in the field would expand that definition of addiction to include behavioral addictions, such as pornography use and gambling. So even though this started, as a tool to describe married couples or intimate partner relationships, similar patterns, of course, have been seen in people in relationships with chronically or mentally ill individuals. So now we are expanding beyond the definition of addicts and using it to include other people with disorders. So nowadays, the term has broadened to describe any codependent person from any kind of dysfunctional family background. And this can be, as it kind of listed off in the beginning, parent, sibling, friend, coworker. All right. Whenever I get a new client who is struggling with something that maybe has a stigma to it or it's embarrassing, like I wouldn't like to be called codependent, I always start with, well, what's the silver lining here? In my opinion, I think if a person is struggling with codependency, honestly, they're probably a loving and empathetic person who desires human connection, as we're all naturally wired to do. Some people feel relief from helping others when they can't sort through their own problems, right? It's a lot easier to offer comfort to a friend who's just been dumped versus dealing with yourself and your own emotions when you get dumped. Yeah? At least that's been my experience. Now, obviously, there's a lot of cons, and the cons definitely outweigh the pros. The cons are, despite these people having good intentions, they try to take care of a person who is experiencing difficulty, but the caretaking becomes compulsive and even defeating. So codependents then take on this martyr's role and become almost sort of like benefactors to an individual in need. So like an example of this would be a wife who's covering for her alcoholic husband, or a mother making excuses for a truant child who's skipping class. Or a father may, pull some strings to keep his child from suffering the consequences of delinquent behavior. The good old kind of privilege, nepotism we all love. So the problem is that these repeated rescue attempts allow the needy person to continue on the self-destructive path and to become even more dependent on the unhealthy caretaking of the benefactor. So it's kind of hand in hand. There's kind of two people participating in codependency. There's the person who keeps rescuing them, the person who keeps trying to fix it, make it right. Then you have the person who is consistently messing up, whether it be like addiction or they're messing up perhaps unintentionally because they're not getting care for their own mental health issues. So I also, through the show, want to talk about stereotypes, kind of stigmatized ways that we think about these disorders, if there's something, somewhat common that most of the general public is at least familiar with. I would say codependency meets that criteria, right? We talk about, oh my gosh, yeah, like middle school girls, they're so codependent. They have to take a whole pack of each other to go to the bathroom. That one, I don't know why, that one always burns me up. I think because like it's like inherently sexist, I think. The girls go to the bathroom together for a variety of reasons, right? Sometimes I'm going with a friend to the bathroom because I want to talk shit. And I really can't do it in the setting that we're in. So it's like, I have to go to the bathroom. Will you come with me? Wardrobe malfunctions, anyone? I mean, it's like, hey, can you come with me and check? I think I just started my period. Oh my God, happens all the time. But like on a deeper, more kind of sinister level, I think it's also important for us to kind of like acknowledge this pattern of behavior as like a learned safety behavior, right? Girls and women, especially if they're alone, statistically, it's not looking too good for us. So my kind of working theory of that particular stereotype is like, yeah, why do you think they go to the bathroom together? You think they want to walk down that dark hallway alone? Like let's say you're in a club. Yeah, I'm going to walk down this dark, empty hallway alone to go to the bathroom. Meanwhile, there's inebriated men leaving the male's restroom. You know what I mean? Like I always take a friend with me. And I think that is valid. I think that needs to also be a part of the conversation. Now, for a more like boy kind of example, I guess like the best thing I could think of was like the nice guy, right? Oh, nice guys finish last. Let's say that they're clingy. They are texting you constantly. If you leave them on red for an hour, they're freaking out. That's kind of more like the codependent behavior I've personally noticed in boys, and who like this behavior I have heard other women also describe. So that's kind of like my male example of that. And of course, like, there's a lot of different factors that go into why a person is codependent, whether it is a safety behavior, it could be a trauma response. There's a lot of different reasons behind it. So what do we do about it? With a lot of this stuff, it's like, damn, that makes sense. Okay. But also like, and so how we go about treating these things in the field, I would say for the most part, a lot of clinicians would start with attachment styles. I don't know how familiar you all are with attachment styles. I have seen it become more prominent on social media, on like TikTok and things like that. So we have like avoidant, anxious, and secure. So the anxious person is more than likely doing a lot of codependent behaviors. They need reassurance. They want responses if they text or call. If they feel the vibe change, they want reassurance. They're very much, what you think of when you think of clingy. And this is for a lot of reasons. I think like the more kind of attachment style purists would argue that like our attachment style is solidified in childhood, and it's based on what happened in our household, how our parents responded to us as babies. Did they do the cry it out method, or did they come pick us up and rock us back to sleep? Things of that nature. And while I think that is for the most part true, I always, I hate the stereotype that like, oh, sure, it's all mom and dad's fault. It always comes back to mom and dad. I don't know if that's because now I am a parent and so I'm low-key scared, but I think it is important to also acknowledge, other early childhood experiences with authority figures, whether it be doctors, teachers, coaches, or just really significant relationships you had as a kid. Growing up, I had like this best friend. She was a year younger than me, lived across the street, and we were super close friends for a really long time. And I think that relationship was really formative for me in a lot of ways. So the avoidant person is more like, I need space. And these, I would say, are your more kind of classic introverted people. Of course, I wouldn't say it's the majority. I would just say in my lived experience, most people who have this avoidant attachment style that I have known usually are more introverted. So it's difficult for them to handle difficult emotions or negative emotions, I should say, whether it's their own or someone around them. It's just like, you know what, before I can address this, I just need to take a minute and like either let it sink in, mull it over, just kind of give my brain time to catch up with whatever I'm feeling in my gut right in this minute. So the third one, secure, is basically like we have a balance of both, right? Every once in a while, someone needs reassurance. Females in particular, because of being raised in the patriarchy, I do see females wanting more reassurance from their partners, regardless of if they're extroverted or introverted. Anyway, that's not to say that, if you seek reassurance or you seek it more often, that you're like a codependent person. No, these are all just like behaviors, and together, if they are like sustained, or there is a pattern over a period of time, then we can kind of call it codependency. But I don't think it's fair to just be like, they're codependent without kind of like providing evidence for that. A lot of counseling and mental health actually requires providing evidence for things. We don't just make shit up or be like, you seem sad, let's call it depression. No, we want to make sure that we are defining our terms in a really clear way, because that's how we're going to be able to find treatment that works for you in a more efficient way. So, attachment style wise, the clinician is going to want to see if this adds up. Is one person anxious and one avoidant? Are they both anxious and that's amplifying these codependent behaviors? What's going on? And like attachment theory is really, it just has good vocabulary for talking about these codependent behaviors. So I think a lot of people go that way. This helps us determine the problem, different parts of the problem. Something that I have used is a tool called the Friel Codependency Assessment Inventory. And I can't remember how many questions there are exactly. I want to say it's like 50. And more or less they're true or false statements, okay? And when I first read this, I was like, wow, I am more codependent than I realized. Because some of the questions on there don't seem like, oh, that's a disordered behavior, right? It seems like kind of normal things that people do, normal feelings people have. And so you're reading through it and you get a statement, and I have some here that I'm going to list in a minute, but you're like, doesn't everybody do that? And for some of them, sure, I think they are. Some of them are more common than others. But like I said, if you have a sustained pattern over like a length of time, let's say 3 to 6 months, with a specific person, that's when it's becoming more like, okay, we need to examine this closer, particularly if it's starting to intrude on your own health and wellness, right? So the questions on the Friel Codependency Inventory are like, true or false? I would be embarrassed if people knew certain things about me. Yeah, I think we would all, to a certain extent, say that that's true. Now, for me, it's less true now than it was 5 years ago. 5 years ago, it would be like, oh, yeah, I got a whole, chapter of banned books in my mind that I do not want anyone reading. But for me now, it's like, okay, maybe that's a little embarrassing, but like, if you're the type of person who knowing this information would decrease my value to you, then like, I don't really want you in my life anyway, if that makes sense. Is it still embarrassing? Yeah, obviously, but it doesn't impact me as much as it would have 5 years ago. Another question would be like, true or false? I have enough help to do everything I need to in a day. For a lot of the moms out there, that's probably not true. For a lot of the single parents out there, I should say, that's probably not true. For elderly people, that perhaps is not true. But even for just regular adults, you know, like maybe they're able to accomplish tasks, but they don't feel helped or supported in another domain of their life, maybe emotionally, something like that. Another example of a question that kind of caught me off guard. It said, I hold back my feelings so I don't make others feel uncomfortable. I thought, like, how is that codependent? That's like, I am intentionally, you know, this is something that's happening internally. That's what I'm trying to say. It seemed like so internal to me. I'm like, why is this on the codependency inventory? When I think codependency, I'm thinking about two people. I'm not thinking about me as an individual. And that's part of the problem. The other question I saw that kind of made me stop in my tracks for a minute was, true or false? When someone I love is bothering me, I have no problem telling them. I was like, hell no. Are you kidding me? If I told every person who was annoying me, like, hey, you're annoying me, like, I can't even imagine doing that because it's just so out of the realm of possibility. And I know that's not exactly what that statement is getting at, but like, confrontation is hard and I will avoid it almost at all costs. Again, 5 years ago, pretty much at all costs. Nowadays, oh my God, watch out. I have no problem. Maybe it's because I'm in my 30s now. I don't know. But that was another one that kind of like caught me off guard. The other things almost seemed like compliments, but then you're like, I don't know, is that codependent? So an example of that was, true or false, people admire me because I do so much for others. I was like, how is that bad? But it's like, if you are going to spend a lot of time helping others to the neglect of yourself, that's a little disordered, you know? So that kind of summarizes just the Friel codependency inventory, like in general. There's a lot more questions on it. But as you can see, codependency, it's not just for the people pleasers. Yeah, I think that is a huge component of it, and certainly people pleasers make it like easier to spot, but it also kind of involves more socially anxious people, right? Like, yeah, I am going to repress my feelings. I'm not going to confront that person if they hurt my feelings. And it kind of becomes clearer that like, all right, boundaries are a huge part of that. So that's one of the first things that a clinician would work on with a client is like setting boundaries. You know, saying like, hey, you know what? It's okay when you're kind of like joking with me about previously being in a cult, but if you start joking about my daddy issues, like that's kind of messed up, man. Like that one hits a little bit harder for me. Can you not? 5 years ago, I would not have been able to say that. I would have just took it in stride and then cried myself to sleep that night. But now I have no problem like drawing that line in the sand. And I think that's really empowering for people once they can get over, you know, the fact that sometimes your boundaries are not going to be liked by others. The second component to all this is mindfulness. And it's not just because mindfulness is kind of like this trendy mental health term at the moment. I think mindfulness is a part of the treatment because we are keeping ourselves busy when we're helping others, right? How can I help them? Should I call them and ask them if they need help? I made dinner for them tonight. I need to go drop that off at the house. And we preoccupy ourselves so much with the needs, the thoughts, the wants of others that we don't have time to sit in our own feelings and take inventory of our own life. And while that may be subconscious, it's very intentional. This is kind of where the avoidant person might come in a little bit more, where the anxious person maybe has to set boundaries for themselves and for others. Now, CBT, for those of you who don't know, stands for Cognitive Behavioral Therapy. And that is a very, very large category of lots of different treatment modalities. So like, I don't know, for those of you in the mental health world, or for those of you who have been clients, things like REBT, DBT, any kind of cognitive and or behavioral therapy falls under this big umbrella. Now, I think it was Beck who had the CBT cognitive model, which is basically like we have these core beliefs that we kind of develop in childhood. When something similar to a childhood situation comes up in our lives, or it makes our brain remember a childhood situation, we are going to have these automatic thoughts that pop into our head about ourselves and about the world. Like for me, I always use the example that men are scary, right? Like, and that could be because, you know, I had a male babysitter who like yelled or something as a child. And so I kind of have developed this thought of like, oh, men when they're angry are scary. And that pops into my head when my partner just raises his voice at me during a discussion, a healthy discussion. And so it kind of triggers, though, this feeling, lots of feelings. It triggers emotions, which then impact how we respond, our behavior, and sometimes can even affect us physiologically. Maybe my heart rate goes up. Maybe I'm feeling flooded. Maybe I get tightness in my chest. So it's like this domino effect that we can really tease out and kind of like follow the thread from, okay, what happened and where did it come from? So I use this cognitive model to like address core beliefs that pop up. Like a common one, especially for like Americans, is like, I'm worthless unless I'm producing something or making something, primarily money. You know, if I'm not making money, then I'm worthless. And those are the types of things I would address for a person who maybe has codependency issues and they are spending lots of money frivolously on gifts for their partner so that their partner will stay with them or to solidify that relationship. You know, so that's something I would kind of tease out using CBT. If we can work it back to a core belief, then tackling the core belief. If we can only work it back to, you know, those automatic thoughts that you had in the moment, that's fine too. We can totally tease those out and see if they're rational or irrational, and then be a little bit quicker to identify them the next time they pop up. So really, there's lots of different ways to go about treating codependency. This one, I feel like we have to do it in every treatment. Just self-care. Self-care. Are you taking time to love yourself the same way you take time to love others? Do you show love to yourself as frequently or in the same way as you show love to others? And that really kind of changed my mindset on setting boundaries, because it was like, okay, I'm setting a boundary when I say you are not allowed to hug my child if my child says no, right? That's me setting a boundary to another person. When it's a boundary for me, like, I didn't even know you could do that. when I had to start setting work-life type boundaries. Like, okay, you know what? As far as my timesheet's concerned, I am clocked out at 5 p.m. That means I'm not answering emails or making phone calls or seeing clients until the next morning. And that was hard for me. You know, I deal with a lot of crisis and trauma work. I deal with people in various fragile states of addiction or eating disorder recovery. And so it's very, very tempting to want to immediately respond if you feel like that person has a question or they're struggling or whatever it is. But you have to set those boundaries with yourself too. And self-care kind of like gave me permission to do that. Because if I am giving myself permission to do the things I love and do the things I enjoy, like give myself time to paint or read, then why would I not also protect my time and my peace by setting boundaries? So that's another huge component. And that's something I feel like a therapist can help you design a better self-care practice, because self-care, it's not like the Donna Parks and Rec treat yourself day, okay? That is not the self-care I'm talking about. The self-care I'm talking about is like nurturing yourself the way you would nurture a child or a friend or a beloved family member. So for me, it's like bathing myself is a big part of that practice. I'm a mom of 3 kids. Normally it's like, okay, I'm hopping in the shower, washing my hair and washing my body as quickly as I possibly can. So if I'm going to like take an intentional, mindful self-care shower, I am like pulling out of the stops, okay? I like get the loofah that feels the nicest and the nice smelling body wash. And not only am I going to wash my hair, I'm going to do a deep conditioning hair mask. And then, I'm going to get myself a whole facial, whatever it is. Because so often I feel like I'm not worthy of that time. I'm not worthy of this really elaborate shower routine because I got to get in and I got to get out. But the truth is I am worthy, and no one else was going to tell me that except for me. Who else would come up with that idea of like, yeah, you are worthy of that time and attention and that special care in the shower? Nobody, and so that's part of it too, I think, is like you are giving yourself that permission to be worthy. And that's something only you can give yourself. As we begin to set boundaries with the people we love, a really hard thing happens, particularly for the empaths. They hurt. Their feelings are hurt. They may feel a hole where you used to plug up their aloneness, their disorganization, their addiction, their irresponsibility, whatever it is. They will feel a loss when you take a step back or set a boundary. And if you love them, if you care about them, this will be difficult for you to watch. It will feel uncomfortable. But when you are dealing with someone who is hurting, remember that both of your boundaries are necessary for you and helpful for them. If you've been enabling them in any way to be irresponsible, your limit setting may nudge them toward responsibility. And that is a quote from Henry Cloud. That is pretty much all I have to say on codependency at the moment. I would love for feedback on this first ever episode. I hope you guys are willing to take this journey with me as I learn how to edit and upload and create content. I'm very much looking forward to that learning process. And as always, I'm grateful for your support. I'm grateful for the people who have seen me grow in the past 7 years from being a very meek, very scared person to, the woman who is kicking ass at her job, at being a single mom, and who is now a homeowner. People who have witnessed that journey and who have been so gracious to me during that journey. Like, I really dedicate this first episode to you because I don't think I could be where I am without your support. So that is bad therapy. If you're feeling like you have some codependent behaviors, or you feel like maybe there's a relationship in your life where you allow someone else to be codependent on you, seeking therapy might be really, really helpful. And it often can uncover maybe other things, dysfunctions going on in our life. And I understand that can be a scary process to start and to open that door to Pandora's box, more or less. But if you're committed to living a healthier, happier life, and if you want to be the best version of yourself, I highly recommend going to a therapist or a counselor, and even if it's just for a few sessions, doing like a mental health checkup, just like you'd go for a physical. And I know some of you are thinking, I don't even go to my physical. Okay, well, regardless, try to take better care of your physical and mental health. If you are feeling any depressive thoughts, any suicidal ideation, please seek help. Know that you are loved. Know that you belong here. Know that there are people out here who love you, and whose life would be a very empty place without you. The National Suicide and Crisis Lifeline number is 988. It's available 24 hours a day. If you don't like talking on the phone, if you Google crisis helpline, text line, text service, there are usually local resources who can get you connected to someone, get you connected to resources via text if it's just too hard to talk on the phone. Thank you all so much, and come back next Sunday for perhaps some exclusive content for our patrons and another episode of Bad Therapy. I'm your host, Sam Diego, and it's been a pleasure.